In what is becoming par for the course, sadly, the federal government is continuing to fall woefully short with a COVID-19 vaccine injury compensation program known as the Countermeasure Injury Compensation Program, or the CICP. As we reported here at Trial Site News earlier this year, this abomination of a program has only processed a handful of claims these past few years, despite over 12,000 claims now stuck in limbo. And do you know what sort of nonsense this embattled agency is now blaming for the slow process? If you guessed having no computer systems to process claims, then you are correct. What fresh hell is this? Well, that, my friends, is going to be the subject of today's episode. And so from Trial Site News, I am Adrian, and our episode is starting right now. So, with almost 12,000 people having filed claims with the Countermeasures Injury Compensation Program, the Vaccine Injury Compensation Scheme, established with the National Public Health Emergency, has done a terrible job. You see, only a few of these injured people who have filed claims with this CICP have even managed to secure any kind of payment. Worse still, those who have been compensated for vaccination injury have, on average, been awarded roughly $1,500 per claimant. What in the world is this agency doing here? For those who were injured during the pandemic from the vaccine, we have a tragic and outrageous situation unfolding, especially considering that for many, they were mandated to take the shot, and the government, while overreaching in many respects during the pandemic, has done little to nothing to anticipate the tens of thousands that would claim injuries. This absurd program is grossly understaffed, and now a director from the Countermeasure Injury Compensation Program told a Georgia-based congressman that they had no technology to support the scale-up of the program, and that the CICP program was severely understaffed. So who, then, in the federal government is responsible for this reality? Well, WXIA-TV, or 11 Alive television station in Atlanta, Georgia, affiliated with NBC, covered this disturbing program. In their article on 11 Alive, they revealed that to date, out of the 12,000 people who have filed a claim, just 706 claims have even been processed so far. And out of that 706, only 22 claims have been approved. But get this, out of the 22 that have been approved, only 3 of the 22 have actually been compensated. And the rest of the 706? Well, the government is saying to them, screw you, to the overwhelming majority of those filing claims. And then, of course, we have the thousands of other people stuck playing the waiting game with the CICP. Case in point, Alan Story. According to 11 Alive, Story is recovering 2 years later from a cascade of health problems after receiving the vaccine. As the medical bills mount, he has no idea if his claim will be approved. He said to 11 Alive that they keep asking for more, and it's just roadblock after roadblock. For months now, 11 Alive Investigates has been trying to get answers on why the process is taking so long. In response, lawmakers across the country have responded with their own questions. Mike Collins, for example, representing the 10th District of Georgia, has demanded to discuss the growing crisis with CICP leadership. The CICP's leadership is now claiming that the technology is the core of the problem. This according to Rebecca Lindstrom from 11 Alive. For example, Collins reported that the CICP Director Program lamented the lack of technology to support the scale out of the program. As Mike Collins put it, they did not even have a computer system in place, a software system to handle people making requests, or even inquiring about what their status was, which was what you were talking about in y'all's reporting. Although the CICP recently launched a claims portal to track claims, they are now purportedly requesting an additional $15 million from Congress to, quote, enhance communication, end quote, as well as substantially increase its capacity to review at least 2,000 claims. But even this is clearly not enough. While the CICP hopes to access technology that can help the federal group scale up to 2,000 claims, there would still be thousands and thousands of people who would still be waiting in limbo. At the current caseload rate of claimed COVID-19 vaccine-related injuries, the CICP director informed Congressman Collins that it would take 5 years to get to them, which is ridiculous. In addition to the lack of technology, which represents a complete lack of planning on the part of the federal government, Collins reported to 11 Alive that a third of the federal employees have been working from home, and that just doesn't work very well. Last year, the CICP funded only 34 positions to deal with the over 11,000 claims then in limbo. And now the federal group proposes a budget for an additional 42 full-time employees. But considering the snail pace of this organization, this additional 42 employees hardly seems enough to handle the caseload. Mike Collins said, "You're asking the same question that we ask. They don't know how many people they employ. The federal government, these departments, they don't know. And so that's one of the big issues that we have. You're right. Do you have enough people who are inefficient, or do you not have enough people?" Now, the plight of the Story family featured in this latest piece from 11 Alive is hardly an exception for those on the waiting list. With the average payout to date of $1,500 and just a few people compensated, Alan Story's bills accumulate to what will likely be in the tens of thousands of dollars. So what are people injured by the COVID-19 vaccines supposed to do here? In many cases, they were mandated to get the shots, and at the same time, the government compelling the procedure waived all liability of the vaccine manufacturers, which just seems outrageous to me considering the scale of vaccination that was planned. When you think about the potential risks that we were exposing the population with, this just seems outrageous. And yet it still happened. Worse still, as Rebecca Lindstrom of 11 Alive pointed out in her story, it is also likely that most people injured by the COVID-19 vaccines may not even be aware of the CICP program. As Alan's story in their article was quoted as saying, "I don't think most people know this program exists. You can probably walk down and 10 out of 10 people don't know about it. I don't know how they would find out about it if they weren't specifically looking for this program. Most doctors don't even know about it." This lack of awareness also represents a problem for people injured by the vaccine seeking help from the private sector. And when you couple this with the immense pressure from news outlets and social media sites to censor conversation on this topic, one has to ask the question, why? What is the purpose of keeping information from the public? There is a confluence of government, media, and social tech companies collaborating during this pandemic to censor key information, including stories about COVID-19 vaccine injuries, even if the information is truthful, which is incredibly disturbing and dangerous. Clearly, the federal government has much to answer for here. Not only did they completely and disgracefully overstep their authority with the dystopian authoritarian lockdowns and mandates, but they also managed to completely bungle caring for those in the population who did end up becoming damaged by the mass vaccination program. It doesn't matter if it's rare. If people get injured, you take care of them. Period. This is an absurd situation that should never have happened. The government needs to step up and take care of the people injured. No excuses, no whining, just get it done. But of course, considering how incompetent the federal government has been these past many years, I'm really not holding my breath that change will be coming in the immediate future. But of course, time will tell. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written articles published every day, 7 days a week, feel free to check us out at trialsitenews.com. And as always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.